My name is Hannah McLeod and I work for the City Mental Health Alliance in Hong Kong. This clip is part of a series of gathering viewpoints from experts focused on supporting employees to stay mentally healthy amid COVID-19. This week, we welcome Sofie Jacobs, founder and CEO of Urban Hatch. Urban Hatch helps firms support employees during moments that matter and provide individual support to women and men throughout expectancy, birth and beyond. Welcome, Sofie.
Thank you, Hannah, for the introduction and for having me today. And everybody, a big warm welcome to this mini session on emotional well-being during expectancy and COVID-19. I think we can all agree that the current crisis is challenging many people's emotional well-being. And what I would like to do today is zoom in on the group of people that are expecting a baby, because pregnancy is already a time that comes with lots of excitement for sure, but also with a fair amount of uncertainty and anxiety. So we're going to look into how COVID-19 challenges the emotional well-being of expecting parents and what can be done to support that. So what we're going to cover is the challenges. We're then going to also briefly talk about identifiable symptoms that can be a result of the extra COVID-19 challenges on emotional well-being that we see in expecting women and men. And we'll then move into briefly discussing a few tips and strategies that can be adopted by expecting women and men themselves to support themselves in their emotional well-being, but also tips and strategies that can be adopted by HR professionals and team leaders for them to support their expecting employees, their expecting team members during the current crisis. Now, whenever we are working with expecting mums and expecting dads, as I briefly mentioned a couple of slides ago, pregnancy is by default going to come with a number of uncertainties, concerns, worries, and anxiety, and that is just nature. So what happens then if we actually add onto that already existing challenge, the current crisis, COVID-19? Now, we have been working with a large group of pregnant women and expecting men in the last few months. We've done a number of support sessions. And what I'm going to talk about today is really data that we've extracted from doing the support sessions. And pregnant women, for them to be able to thrive during pregnancy, they need to feel physically and psychologically safe. They need to feel that they're socially connected to other human beings, especially their inner circle and also expecting mums. And they also need to be able to feel that they're actually in control of making healthy, positive, good decisions for themselves and also for their unborn growing baby or babies. Then when we look at partners, partners want to feel included in the antenatal care process. Partners want to feel that they're able to support their pregnant partner in the most optimal way. They also need to feel supported themselves. And this is actually something that's very often challenged even outside of the crisis. Now, what does then COVID-19 challenges? So the first and biggest point that I want to make today is that there's very much amongst this group of people currently a reduced sense of physical safety, not just amongst pregnant women, but also partners. A couple of examples that we have identified. Many people are worried about the lack of knowledge that we have about the actual virus. If I were to get this, how is this going to impact me as a person? How is this going to impact my unborn baby? Partners are worried about this as well. If my expecting partner, if my pregnant partner gets the virus, how is this going to impact her health and the baby's health? Attending hospital appointments. Many women and men we have found in our support sessions are very worried about attending those, yet it is something that is crucial for a pregnancy to evolve in the most safe way. But going to the appointments makes them actually feel physically threatened in a way. then there's also very much a sense of loss of control. And this, we feel, is very much related to the uncertainties that come with the crisis. How long is this crisis going to last? My due date is in June. What is the COVID-19 landscape in Hong Kong going to look like at that time? Am I still going to be able to attend my antenatal appointments? Is it safe for me to give birth in the hospital? Partners are going to worry about being able to support their partners in the public system in Hong Kong. Partners are not allowed in the labor room at the moment. This can change very quickly, but those decisions are out of people's control. So there is that big sense of loss of control for sure. Lack of human connection, not just because of social distancing, but also because of the work situation. Many firms still have working from home policies in place. That is going to reduce people's ability to connect in that face-to-face, in-person capacity with colleagues, and that does affect emotional well-being. Lack of human connection with family. I just wanted to give a couple of examples. We've been speaking with a number of women and men who definitely are feeling that there is a sense of loss related to the pregnancy. People feel that the pregnancy is very different from what they expected. It's not something that they're now able to share in the same way as they had hoped with family and friends. So there's definitely an effect on emotional well-being because of that lack of human connection. And then support, as we know it, is looking very different. Many people here in Hong Kong don't have their families nearby. Well, maybe perhaps in the beginning of the pregnancy, the idea was for family to come over and help. And we now don't know when that's going to be possible. So there's a bit of loss of control in there as well. But definitely the support as we know it needs to be reviewed, and it needs to be adopted and adjusted. The good news and positive note I want to mention here is that what is very interesting is that we have found during the current crisis that breastfeeding seems to be easier in a way for new mums. And we are wondering whether the fact that there is less visitors and family not to worry about, whether that is actually having a positive impact on breastfeeding. So, you know, there's always a silver lining, and we just sometimes need to look for it. But that is really positive. And support as we know it, it can be adjusted. You know, it's just a matter of all of us thinking creatively. At Urban Hedge, we are doing a number of sessions over Zoom, over Skype, over video WhatsApp. So we need to be creative and we need to be open-minded, but knowing that the support is still there, it's just going to look a little bit different. Then the identifiable symptoms, I'm not going to go through the whole list, but you know, these are symptoms that we have identified in expecting women and men during the current crisis. These symptoms you may look at and go, well, you know, this sounds like something that you can also experience when you're not pregnant. You can also experience this when you're pregnant outside of a crisis. And that is all very, very, very true. But what I would like to point out is that the current crisis is definitely going to increase the chances of expecting women and men experiencing these symptoms. So if you are watching this and you are expecting a baby as a woman or as a man, you identify with a number of these symptoms, it is time for you to then seek some support. You can reach out to us at Urban Hedge. It's okay to not feel okay, and let's get some support. You know, now is not a time to be heroes. At the same time, if you are a team leader or a HR professional, you've got someone in your team who is expecting a baby, and you recognize these symptoms in them, perhaps have a conversation and gently direct them into perhaps seeking extra support. So what are the strategies? What can expecting women and men do to support themselves in their emotional well-being? And what can HR and team leaders do to support team members that are going through that phase of life? Just very briefly, we are not aiming to help them to move from being in a survival state into thriving, because that is not going to be possible. What we need to focus on is getting them into a state of revival, okay? And to get there, for expecting parents to revive, if you're watching this and you're expecting a baby, take time to check in with yourself. It could be a few minutes a day, either first thing in the morning or before you go to bed, maybe at lunchtime. Take a few minutes, turn your energy inwards, have a little chat with yourself and ask yourself how you're feeling. We're not going to label how we're feeling, we're just going to allow ourselves to feel how we feel. And this is really important. You may also want to check in with your partner if you notice that they're not doing so well, they're struggling a little bit. Offer your support and create a safe space for them to share. Now, the easiest way to do that is simply by saying, hey, I know this is a challenging time. I can see that you're struggling. If you need support, let me know how that would look like in your eyes. Let me know what you need. Also ask for the support that you feel you need. And then if you manage to do this, you're going to be taking really, really good care of yourself, and you're going to help yourself to move into that state of revival. Then if you're supporting expecting team members, you want to be able to check in with them individually. If you're working from home, that may be a little bit more challenged, but then use technology, use Zoom, use WhatsApp, whatever is acceptable in your firm, and take time to check in with them individually, again, in this empathic and compassionate way. Creating a safe space is something that's going to happen automatically when you do this, as well as asking the support, asking them what support you can give them if they need it. The last point is really important as well. We cannot pour from an empty teapot. So it's really important for you to check in with yourself. The current crisis, what is unique about it is that we are all in this together, yet each and every one of us are managing their own little mini wave, so to speak. We're riding our own wave. We're also constantly checking in with other people. So we need to make time that we check in with ourselves. Otherwise, we're going to be running on empty, and that's not good for anyone. To find out how you can better support yourself or your team, please feel free to reach out to us at Urban Hatch. My email address is right there. At the end of the day, we are on a big mission to help individuals, expecting women and expecting men, in their well-being, not just emotionally, but also physically. And we're also on a big mission to help firms support their team during during moments that matter. So I really hope to see you again very soon. And until then, take care. Bye.